Hi, my name is Anna Paskovic, and this is my capstone presentation. The public issue I will be discussing throughout this paper is violent crimes and gun violence. Violence is a public health crisis that is currently causing destruction, fear, hopelessness, and injustice across the nation. Gun violence specifically affects the lives of many individuals every year. Although this topic can seem overwhelming and scary, it is crucial that it be addressed so that changes can be made towards a safer world. Violence can result in serious injury or even death to those who fall victim to it. The act of violence is a result of undiagnosed mental illness, availability of lethal weapons, and/or unhealthy coping mechanisms of the attackers. The rise in violence can be attributed to many factors, with some being political extremism, the rise in mental illness, COVID-19, exposure to violence in the media, and stressful socioeconomics. Alina Bradford in 2022 reports that compared to last year, 40%, more Nebraska residents are worried about their safety, 50%. This means that the state grew more concerned than the nation. Nationally, we saw a concern increase of just 1%, bringing the national average to 47%. The Educational Fund to Stop Gun Violence published an article in 2021 saying that violent crimes, including total gun death rates, have steadily been on the rise from 2010 to 2019. A characteristic of being an educated citizen is being also an effective communicator. And an effective communicator uses critical thinking to generate, connect, and organize ideas in a written, oral, and nonverbal manner. An experience that has taught me about being an effective communicator was when the nurse I was assigned to shadow during clinical was actually not implementing effective communication methods while she was collaborating with the physician who was assigned to her patient. As a result, the physician was very dismissive and vague, and he left the unit after assessing the patient's critical condition without communicating to the nurse about the order she should carry out. In the end, the patient's standard of care was compromised as he did not get the medications he needed in a timely manner because of the trickling miscommunication of the healthcare professionals. I learned that effective communication, the use of varying communication methods, and identifying a lack of quality communication is important to the result of all situations. Communication can either positively or negatively impact a situation. Therefore, it's crucial to be the leader of proper communication. I can use what I've learned about being an effective communicator to address violent crimes and gun violence by intentionally incorporating positive communication skills to all of the work I do towards creating change for this public issue. Additionally, I can identify any miscommunication and ineffective methods being used to attempt to create change, such as creating partnerships and educating the public, and address it so that it does not impact the prosperous efforts of the mission. Another experience that has developed me as an effective communicator was one day during clinical when I was caring for a patient who wouldn't respond to me after I introduced myself and expressed how I would be contributing to their care throughout the day. After discussing the situation with my nurse, I learned that the patient suffered a stroke many years ago and as a result is nonverbal. I took it upon myself to adapt to the needs of and adjust my communication skills so that I could best care for this patient. I learned throughout this experience that the importance of acknowledging the different communication needs of patients and of all people in general was crucial. Healthcare professionals need to understand the various communication styles and languages so that they can best tend to their patient needs, but also just people who coexist with others and are constantly interacting throughout the day. It's important to acknowledge these as well. I can use what I have learned about being an effective communicator towards creating change for violent crimes and gun violence by implementing adaptability into my communication efforts. As history has shown, there will be new exposures and unfortunate events that will change the needs of communities, and it's crucial to stay adaptable and knowledgeable about these needs so that I will be able to adjust my communication methods to meet those needs and demonstrate effective, compassionate communication in terms of violent crimes and gun violence. Another skill of being an educated citizen is being a reflective individual. And a reflective individual analyzes perspectives of holism and exhibits personal responsibility. An experience that has developed me as a reflective individual was while I was presented with the opportunity to perform a nursing skill on a patient during clinical. I turned down this opportunity because I was afraid, and so another student stepped in and had the great opportunity to learn more about this nursing skill and about information that was pertinent to their nursing career. I learned that the apprehension that I was feeling when I was faced with this new and unfamiliar situation was because of the care and compassion I had. However, it was important that I use these feelings for my own good and take advantage of that learning opportunity so that I am better able to care for my patients in the future. I can use what I have learned about being a reflective individual to address violent crimes and gun violence. I have learned that by allowing myself to feel complex, scary, controversial feelings that surround gun violence and in using these feelings to generate advancements in the matter, as well as encouraging others to do the same. For many people who have fallen victim to these terrible crimes, many times it's easier to shut down and close off the world to anything surrounding violent crimes or gun violence because of the overwhelming feelings that surround the topic. However, encouraging people to understand their feelings and how to use them to generate change for the matter would be so influential for the community. Another experience that shaped me as a reflective individual was during one of my clinicals while the nurses were doing bedside report. It was the night shift nurse reporting off to the day shift nurse bedside, and so the patient was present, and they were not using a translator in the room of a patient who spoke no English and was a brand new mother. The patient seemed very intimidated and fearful about the situation, and later on that day, I walked into the room and the physician was there speaking to the mother about the procedure of a circumcision for her newborn. The physician was speaking directly to the translator and really rushed his time in the room because he seemed to be a little annoyed that it was taking so long to transfer his information and knowledge to the mother through the translator. From this experience, I learned the importance of spending time ensuring that the patient is comfortable, understands everything involved with their care, and is equipped with the tools necessary for quality healthcare. It is the responsibility of healthcare professionals to be culturally competent and respect every patient's unique needs. I can use what I have learned about being a reflective individual in my work with violent crimes and gun violence by applying the concepts of advocacy, respect for culture, and personal responsibility. There are people of all different backgrounds, socioeconomic classes, cultures, and ages that fall victims to these violent crimes, and they all need representation and compassion. Being a change agent is also a very important skill of being an educated citizen, and to be a change agent takes a change agent takes appropriate initiative to effect changes, draw individuals and or organizations together for a common purpose, and create a voice for self or others. An experience that shaped me as a change agent was as I was volunteering at a flu shot clinic. I met a student in her first semester of nursing school, and at the time I was in my second semester. She was very unfamiliar with the nursing skills and didn't know much about giving IM injections. I took the initiative of educating the student about prepping for the administration, needle size, and best IM injection practices. This girl was so much more confident in administering vaccines and learned so much new information. From this situation, I learned that it's important to ask people what they know about pertinent topics. Having a better understanding about people's background knowledge can help identify any gaps in information that you're trying to get across. Then you can have a better idea about how to be most effective in educating them and therefore bringing about more change. I can use what I've learned to address violent crimes and gun violence by implementing the characteristics of being a change agent into my work. Taking the time to create and additionally address any gaps can help more people understand the importance of this topic. Creating change requires a loud voice, so it's important to educate as many people as possible so that proper information is spread. However, to truly effectively educate people about this topic, it's important to start out by asking them what they know about the topic already and what background knowledge they have so that larger changes can be made for this public health issue. Another experience that shaped me as a change agent was while I was a CNA. I noticed a problem in the way that assignments were being broken up among staff members. I began doing research and trialing different ways assignments could be effectively broken up. Eventually, I came to a solution to the unit's problem and convinced the charge nurse to help me implement it. After speaking up, identifying a solution, and implementing it, the problem of breaking up assignments had diminished, and a new method was much more effective. I learned that while the ability to identify a problem is important, the ability to speak up and actively seek after a solution is arguably more important. A change agent has to go the extra mile, work independently and collaboratively, in order to truly create change. I will definitely be able to use what I've learned about being a change agent into creating change for this public issue, because as I develop a team that works towards decreasing gun violence and violent crimes, I will be able to collaborate and be more willing and confident in creating change. Identifying issues within our process, partaking in communication that will be beneficial to the mission, and working towards a common goal is something that I've learned about being a change agent that I can apply to this. Most importantly, speaking up and encouraging others to do the same when they identify a problem so that we can all partake in being change agents and being impactful for this mission is something that is very valuable. As a student about to enter into healthcare as a nurse, I'm excited to have developed the skills of being an effective communicator, a reflective individual, and a change agent. Not only will the implementation of these characteristics help my work in the healthcare field, but it will additionally assist me in doing beneficial work for public issues. I feel so honored to have been able to spend the past semester identifying the problems surrounding violent crimes and gun violence within our community, researching more about it, and creating methods to help solve this public issue, as well as many other public issues that I am now more aware of because of this project. I hope to continue to spread the knowledge that I have acquired about violent crimes and gun violence and partake in making progress towards a safer community and nation. These are the references that I refer to throughout the presentation. Thank you so much for watching.